time of year when we ditch the pants and grab our favorite sundresses and shorts and bathing suits.
I need a spray tan. But for many women, varicose veins and spider veins can leave us feeling self-conscious about our legs. Is there a real fix? Why does it happen? Are they problematic?
We have all the questions. So Dr. Natalie Gentile is here for Wellness Wednesday to help. We are so glad to see you. I'm starting to develop a couple of them.
Same.
We see them more and more. My first question is, do men get them and we just can't see them because of their hairy legs?
Anybody can get spider veins.
Okay.
Yeah, and varicose veins, which are more the bulgy ones, I always say these were my bonus gift with having kids.
That's right.
Yeah.
That's so nice of them.
Lucky us.
So what are they at their core?
Yeah, so we've got veins all throughout our body. This is the vessels that take that blood that doesn't have any oxygen back to our hearts, okay? Veins are normal, but when the walls of them become weak or the valves in those veins become weak, that makes them bulge a little bit and start to show under that skin more.
And there is a difference between spider veins and varicose veins, right?
Sure, so spider veins are those tiny ones. They're like spider webs, right? They're smaller, they're not necessarily too much weakening of the vessel walls as much as damage that we get in the varicose veins. These are the bigger, bulgy ones. Those can get pretty painful, those can get kind of thick, and really aware of them when you see them on your legs.
Right, well that leads me into my next question. Are they problematic for your simple everyday life? Because obviously veins are doing a very important job.
So I think aesthetically, right, so how they look, if that's problematic for you, that's important. Are they dangerous for your health? No, not necessarily. I mean, they can cause a lot of discomfort if they get big enough, right? You can have itching, burning, pain there. And then I would say always I go back to what's the underlying cause. If it's a dangerous underlying cause, like what we call venous insufficiency, meaning like those veins just really aren't working and you have poor blood flow, that can be a problem because that is only going to get worse over time.
Why is it that we see them primarily in our legs?
So if you think about the legs are carrying the weight of the rest of your body, so they bear a lot of pressure. And so that blood has to really pump up to get back to your heart. It has to work against, it's all plumbing, right? It has more to work upstream. And so when we're sitting a lot, if we're standing a ton and putting a lot of pressure on the legs, if we're pregnant and carrying a lot of extra weight around the belly, that can put a lot of pressure on those veins and make it harder for the blood to get back up.
And there's something obviously we're open to and we talked a lot about on this show are the different procedures that you can get to lessen the visual aspect of these veins. We actually have someone close to us who got the procedure for varicose or spider veins and nothing ended up really fixing itself. Are these procedures something that you suggest as far as cosmetically, or are they all going to end up back?
I always start with less invasive, so starting with our compression stockings, if you can even try to wear those more consistently, that can help. If you're sitting a lot, getting up and standing and moving around at least every 30 minutes or so. But then if we're going the procedure route, these aren't 100%, you know, but I think they are worth at least talking with a vascular surgeon about, because if it's something that you might benefit from and these are really bothersome for you, it's worth knowing the risks and benefits.
Absolutely, I think so. There are a lot of myths surrounding how we get them. And you mentioned a couple of the sitting too much, standing too much, being pregnant can lead to them too. Crossing your legs. I feel like since I was a little girl, I heard, don't cross your legs, you're gonna get spider veins or varicose veins. Does it cause them?
We cannot definitively say that crossing your legs.
Okay, thank you.
So
thank goodness.
Cross away.
Okay, so it is ruining my lower back, but it is not ruining my veins.
Exactly. It might be hurting other things. Giving you hip pain.
All right, cool. 1 for 2. That's a win.
That's fine.
That's a total win. So are there other ways besides just moving our bodies more that we can prevent them?
So we definitely know that maintaining a comfortable weight for your body size can be helpful because, again, it's a lot of that pressure and that pressure on the lower body that can happen when we're carrying a lot of weight around the middle. Definitely the compression stockings we talked about. Exercise. So if you think about those vessels in the legs, the muscles are around them. And if we move those muscles, it helps pump that blood better through the vessels.
And once we've started to develop them, is there really any going back? Like, can you push back in? Like, get them back in?
I could just stay down.
You're right.
Unfortunately, that's unlikely to happen, that they're going to go away.
All right, great. I know, because some women are very self-conscious about it. They feel bad, and this person that we know doesn't even want to wear shorts because they feel so bad about the appearance of them, which I don't know that any of us really care, but it makes her feel bad.
Certainly.
So,
absolutely. Well, just know that the procedures are out there.
All right.
Happened
Thank you so much.
Thanks again. If you're interested in learning more about direct care of physicians of Pittsburgh or Rebel Wellness, we have that information on our website, kdk.com/talkpittsburgh.